we have increased our projections to September 1st. Right now in the United States, we are projecting 1,020,000 deaths by September 1st. That's an additional 29,000 deaths from May 2nd when we run our programs. For the United States, the recommendations remain the same. We need to continue our surveillance and make sure we are doing enough sequencing to know what variants are circulating in the United States and if BA4 and BA5 are being introduced in the US and how fast they are spreading. At the same time, we need to ensure that we have enough antiviral medication in order to distribute them. We know from their clinical trials that they will reduce hospitalization and mortality, and they will reduce the pressures on our hospitals. And third, which is very important, if we are seeing a rise due to another variant in the United States, we should go back to wearing masks and physical distancing. In the United States, we are seeing an increase in reported cases and hospitalization. In some states, we are seeing the rate of increase in admissions to hospital is much higher than the rate of increase of reported cases. We believe that's due to the fact that many people are testing themselves at home and not reporting to their counties and not using the local labs, and we are not capturing these cases. We are monitoring closely what's happening in South Africa, the infections with BA4 and BA5. We don't know yet if BA4 and BA5 are immune escape and they are infecting people who have been previously infected by BA2. It's too early to tell. And the fact that many people in South Africa have been infected by Omicron 4 or 5 months ago, it's possible that's a waning immunity that's resulting in the infection from BA4 and BA5. At the global level, mortality from COVID-19 is the lowest since April 2020, and the global trends are mainly dominated by what's happening in China. Right now, we are seeing a rise in cases in Taiwan. China is continuing with its zero COVID-19 policy, and we feel that they will be able to control COVID-19 for a while. However, the economic pressure may not allow them to continue with such a policy. If what we are seeing happening right now in Taiwan or previously in Hong Kong will happen in China, we will project a lot of mortality, unfortunately, and the surge will overwhelm the hospitals because many older Chinese are not vaccinated at the same level as other countries, and also the vaccines used in China are less effective than the vaccines used elsewhere, mRNA vaccines. So we'd expect a major surge and a rise in mortality in China. Based on vaccination rates and our monitoring of people who are willing to take the vaccine, we estimate right now that about 3.1% of people globally who want to get the vaccine and willing to get the vaccine have not received the vaccine. Unfortunately, the majority of them are in Africa. We need to make sure that people who want to get the vaccine are receiving the vaccines through fair distribution. Rich countries should support poor countries to get the vaccine and vaccinate their population. Again, we're not safe until all of us are safe. The most important thing moving forward right now globally is to ensure that the global distribution, like with vaccination, the global distribution for antiviral is going forward, and countries can secure what they need from antiviral in order to provide it to people who are infected to reduce hospitalization and mortality. We're not projecting a rise in cases in the Middle East and the Eastern Mediterranean region, WHO region, but we are concerned in many Islamic countries after the Eid celebration with all the mobility and people are visiting each other and celebrating the holidays, that it's possible in some of these countries the decline will slow down, and it's possible in some countries that we'll see a small surge in the coming weeks due to the holidays and the celebration. At IHME, with our projections, our major challenge in the coming months is the delay in reporting. Many countries and many states have moved to weekly reporting, and it's very hard for us to monitor the situation. And the fact in the United States that many people are testing themselves at home and not reporting their infection to their local health departments, it's making it hard for us to follow the epi curve. We are right now using Admissions to hospitals, COVID-19 admissions as our main indicator, and in some places like the United States, where we believe many people are testing themselves at home and not reporting those results to their local health departments, we have lowered the infection detection rate in order to make sure we'll be able to monitor these trends.